Byers Chiropractic Center. I thought today I'd show you actually what a spinal adjustment is and how I perform one. I said in some of my earlier videotapes that I do most everything by hand. I don't do instrument adjusting. I do what's called diversified, and then I do something called flexion distraction on some patients for some types of conditions. Betsy's been kind enough to be a patient today, and I just kind of want to walk through what happens when you do get an adjustment, how it looks like, how it feels, and what you can expect to happen in the chiropractor's office. First thing I do is always what's called a pre-assessment. I test the joint that I'm going to adjust. Wherever I find my typical fixation, that's where I do an adjustment. If I feel the patient needs it in 3 or 4 segments, I'll do that. If I don't find any restrictions or fixations, I won't do that either. I find that she's kind of tight in that right C7T1 and then through in here. When I get down to the lower spine, I utilize a couple tools. Obviously palpation. I might do something called an orthopedic test to find the fixation. Or I might do something called a leg length. You can come here and see this if you like. In Betsy's case, what you're looking at is what's called a leg length. See if one leg's shorter than that. In her case, you see how that right is a smidge short, probably 5 to 10 millimeters. So what I'm going to do is I'm going to adjust up here, through here. I'll lay her on her side since she's a nice healthy subject. Do the side line, and then I'll also show you what flexion distraction is. Once again, I've already had an exam on Betsy. I know exactly what to find on her. She may or may not have had the massage therapy. She may or may not have the ultrasound. As you can tell, sometimes there's noise involved with this, sometimes there's not. The bottom line, I've been doing this for 12 years. When they get off the table, if they feel better, that's what we're looking for. My wife affectionately calls this mommy back sometimes. Most mothers with small children have this. Betsy's actually has a 2-year-old. So. Let me show you the flexion distraction. This is a technique, as I said before. Typically that right side, how this is moving here. I'll do first what's called a flexion, increase the space in her lower back. There's a protocol that, like I said, once again I follow. Every patient does not get the same protocol. I think it's important for you to know. I was fortunate enough in chiropractic school to be involved with the first federally funded study on a chiropractic technique, and that was flexion distraction. So I saw firsthand the research that we did on this. And the end result of that research is they showed only 8 to 10 millimeters of movement was needed to open up the facet joint. To help what we're trying to do. So as you can tell, I'm not doing a whole bunch of movement on her. That's what's called flexion distraction. Betsy's also a candidate to do what I call side lying. You can lay on that side for me, face me this way. Put your bottom leg straight, top leg bent. Just like that. Once again, sometimes you hear things, sometimes you don't. You can lay on your stomach. Now let's post-assess her. See how we did. So starting at the top. Right side's moving easier. The thoracic is moving easier. Then on the lower back, if you come down here, you can see it's 0 out. You can now see she's equal on the left and right side. So That's what I consider spinal manipulation. Thank you for your time. For more information, you can go to my website, www.drjimbyers.com.